Today, we're diving into a rare and absolutely devastating genetic disorder that quietly steals childhoods. It's called Sanfilippo syndrome, and it's a story about a hidden disease, a heartbreaking journey, and a really determined fight for hope.
And this is probably the cruelest part of the whole thing, the disguise. Unlike a lot of genetic disorders that show signs right at birth, kids with Sanfilippo seem totally fine. They look like any other baby. So parents are celebrating all those firsts, full of hope, with absolutely no idea that a storm is gathering inside their child's own cells.
So how does a disease this destructive stay hidden for so long? Well, to really get it, we need to look at the body's broken blueprint. We've got to zoom way in, down to the microscopic level.
Okay, so officially, Sanfilippo syndrome, or MPS III, is a genetic condition that leads to fatal brain damage. It's part of a group of diseases called lysosomal storage disorders. Now, I know that sounds super complex, but the basic idea is actually pretty simple. It's a breakdown in the cell's fundamental cleanup crew.
Right, so here's the best way to think about it. Imagine the lysosome in each cell is like a tiny recycling center. Its main job is to break down this complex sugar called heparan sulfate, but in a child with Sanfilippo, a specific enzyme, basically a critical worker in that recycling center, is just missing. It's not there. So instead of being broken down and recycled, that heparan sulfate just piles up and up, like garbage that never gets taken out. And that buildup becomes toxic, especially to the brain, causing damage that you just can't undo.
The tragedy of Sanfilippo is that it's rooted in genetics that parents usually don't even know they have. It's what's called an autosomal recessive disorder. All that really means is a child has to get a copy of the faulty gene from both parents. Now, these parents are just carriers. They're perfectly healthy. But as you can see here, with every single pregnancy, they're facing a 1 in 4 chance of having a child with the disease. It's a genetic gamble they don't even know they're taking.
So for the first few years, that broken blueprint, it stays hidden. Everything seems fine. But then comes the turning point. That moment when the child who seemed perfectly healthy begins to change, and the disease finally shows its devastating face.
This timeline just lays out the whole tragic story. A child is born, looks healthy. Then somewhere between 2 and 5, maybe some little delays start to show up. Speech isn't quite where it should be, things like that. But the real shift happens between ages 3 and 6. The child's development doesn't just slow down, it hits a peak. And then it's followed by this cascade of severe symptoms, unbelievable hyperactivity, really challenging behaviors, and major sleep problems.
And this just adds another layer of heartbreak for these families, because these early symptoms look a lot like other conditions. So kids are often misdiagnosed with severe autism or ADHD, and this journey to get the right diagnosis isn't just frustrating, it wastes precious, critical years while the damage inside the brain just keeps getting worse.
Along with that neurological decline, other physical clues can start to pop up. Things like slightly coarser facial features, maybe more body hair than usual, an enlarged liver or spleen, and getting sick all the time with respiratory infections. When you put these signs together with the behavioral changes, the picture starts to become clearer for doctors, but it's a much scarier one.
Okay, so now we get to the hardest part of this story, the reality of how this disease progresses. It's often described with a term that is both shocking and tragically spot on: childhood dementia. Just let that sink in for a second. Dementia. We think of that as a disease of old age, of a long life lived. But Sanfilippo inflicts this cruel process on a little kid, systematically wiping out their world, their skills, and their memories.
So what does this actually look like for a parent? It means watching your child go backward. The words they learn to say start to disappear. The ability to run and play is stolen from them. And eventually, even the most basic things like swallowing become impossible. It's the complete, devastating loss of the child you once knew. And in the end, there is no cure. The average life expectancy is just 15 to 20 years. A childhood is stolen and a life is cut brutally short.
But in the middle of all this tragedy, there is an incredible fight. A fight for a diagnosis, a fight for quality of life, and a fight for a future where this disease isn't a death sentence. And this battle, it's being fought on 2 really important fronts.
So, getting that definite diagnosis is a step-by-step process. It starts with a doctor seeing the symptoms we've talked about and getting suspicious. Then a simple urine test can spot that extra heparan sulfate, that cellular garbage. After that, blood or skin tests can figure out exactly which enzyme is missing, which tells them the subtype of the disease. And finally, genetic testing can nail down the specific mutation, which is so important for the family and for any potential future treatments.
And this slide really nails those two battlefronts I mentioned. The first column, that's today's reality. It's all about managing the symptoms. You've got a whole team of specialists, therapists, doctors, nutritionists, all working together to give the child the best life possible. But that second column, that's the future. That's the hope. It's research that is aimed directly at the root cause, with clinical trials for things like gene therapy and enzyme replacement therapy happening right now.
We have to start with the hard truth here. As of today, there is no cure for Sanfilippo syndrome. Treatment is entirely focused on managing the symptoms and improving a child's quality of life for as long as possible. So what that means is that care right now is all about support, and it takes a huge team of specialists. You've got neurologists to manage seizures, therapists working to maintain mobility and communication skills, behavioral specialists to help with the hyperactivity, and gastroenterologists to manage feeding issues. It's this comprehensive, all-hands-on-deck effort to give these children the best quality of life they can possibly have.
But, and this is a really important but, that is not the end of the story. While supportive care is the present, there is a dedicated, intense, global research effort that is paving the way for a very different future. There is real, tangible hope out there.
So let's look at some of the most promising ideas being explored. Gene therapy is a huge one. The goal here is to use a harmless virus to deliver a correct working copy of that missing gene right into the patient's cells. Then there's enzyme replacement therapy, or ERT, which involves just giving the patient the enzyme they're missing. The huge challenge there, though, is getting that enzyme across the protective blood-brain barrier to where it's needed most. Other strategies are trying to use compounds like genistein, which comes from soy, to reduce the waste buildup, or something called substrate deprivation therapy, which tries to slow down the body's production of heparin sulfate in the first place. All of this incredible work brings us to this final critical question, the timeline of this disease. Right now feels like it's written in stone, a cruel thief that steals a child's life away. But with every single clinical trial, with every scientific breakthrough, we get one step closer. The hope, the dream, is that one day, very soon, science will give us the pen to rewrite that story, to cross out that tragic timeline and to write a brand new one of treatment, of health, and of a future that has been restored.